Well, as we continue to talk about the freezing temperatures, strong winds, and heavy snowfall Colorado is experiencing, it's important to take all the necessary steps, to keep yourself safe. But what happens if the worst case scenario comes true? Joining me now is Dr. Shah, AdventHealth emergency room physician. Doctor, thank you so much for joining us.
Yeah, of course. Thank you for having me.
Yes. So for starters, what are some of the most common reasons patients come to the ER when it gets this cold?
Yeah, so definitely when it gets this cold, some of the more common things that we'll be seeing are certainly frostbite and hypothermia. But in general, the more common things that we're going to see are slip and fall just because of the icy conditions. So we'll see a lot of head injuries and fractures, lacerations, cuts and scrapes and things like that. I also want to consider people with underlying heart issues from overexerting themselves in the cold can certainly cause a lot of stress to your heart. And the cold air can certainly cause irritation for people with lung disease like asthma or COPD, so definitely can cause flare-ups of those conditions.
Yeah, I mean, we definitely want to avoid as much of that as possible. So what are some ways that folks can maybe protect themselves from, making a visit to the ER in these conditions?
Yeah, I think a lot of it starts before you even leave the home. So layering, you want to make sure that you're wearing a good moisture-wicking base layer. Kind of wear something thicker over that, like a fleece or a sweater. Some weatherproof pants, and then well-insulated jacket, waterproof, windproof, making sure you're wearing warm socks, and then also want to make sure that your hands, your face, and your head are covered, so good waterproof insulated gloves, wearing a scarf to help keep your face and neck protected, and a hat to keep those ears warm.
Yeah, gotta stay bundled up. Yeah. Let's talk a little bit about some early signs of frostbite. What can people maybe expect to see if that's something that's happening?
Yeah, so some of the early signs of frostbite that you can see, you'll start noticing some tingling and numbness, maybe prickling of your fingers. Might start noticing some discoloration, might start turning pale. Your skin might start turning waxy, and in really severe conditions, you can start noticing your skin turning really hard and maybe even some blisters forming.
Yeah, definitely want to avoid all of that as much as possible. Dr. Shah, thank you so much for joining us. Of course, you can always watch all of our interviews online at CBSColorado.com.